Thank you, Dr. Burgess. And Dr. Burgess and Dr. McCree will both have question and answers together. Dr. McCree, per your program, Dr. Donna McCree is the Associate Director for Health and Equity in the Division of HIV and AIDS Prevention for the Centers for Disease Control. Dr. Hubbard. Again, you're going to find out why HIV is important. One of the questions was exactly in a nutshell, why is HIV important to older adults? And so let's take it a little bit further, consistent with what Dr. Burgess said. Sexuality is something real for many of us, and we still have to be careful. So pass your questions to the front.
Okay. Good morning. I'm really excited to be here, especially since most people don't think HIV is a problem once they get to be a certain age, and there are people who don't think HIV is a problem in the United States either, and that is so not true, not at all. So I am grateful for this opportunity to talk to you about HIV in older adults, and I'm so happy that we had these previous conversations so you all aren't uncomfortable talking about this issue. I've been doing this for 37 years now, so the language kind of rolls out of my mouth. I feel very comfortable with it. And I think that we have to get to a place where we all feel that way in order to address the problem. So I love my job. I do. So I have to include this in every presentation that I do. Saying the findings and conclusions are mine and not necessarily represent the official position of the Centers for Disease Control and Prevention. All right, so I'm going to tell you a little bit about what HIV is, who's most affected by it and why, what can be done to reduce it, what can we do as individuals and communities, and then to sort of summarize and hear your questions and answers. So why am I here today? Well, because older adults are affected by HIV. Because HIV is completely preventable. You don't have to have it. Because we have more tools than ever to fight it and to improve the health of people living with it, with HIV, and because each of us has a role to play in preventing HIV in our communities. So I want to have that conversation with you today. And we're going to do a brief HIV 101. Before I do that, I'll tell you a quick story about my grandmother, my maternal grandmother, probably my favorite person in the whole world. She's been away. She's been gone to live her eternal home now for about 13 years. She was married to my grandfather for 68 years, and he passed away. Well, she outlived him, and she met Mr. Jackson at the little senior get-togethers. And needless to say, my mother and my uncles were not happy about that at all. To which I had to explain to my mother that was none of her business because my grandmother was her own person. But after that, my mother and my uncles elected me to speak to my grandmother about engaging with Mr. Jackson. It probably was one of the greatest times I've had in my life because here I was, my grandmother was 45 years older than me, and I had to sit down and talk to her about Mr. Jackson. And what I realized was my grandmother didn't know very much. Having been married for 6 to 8 years, she had 8 pregnancies, 4 deliveries, but she had no clue as to her own sexuality, what to ask, what questions to ask, because she said to me, you know, baby, back then, we just did what they told us to do. So I said, well, Grandma, it's a new day, and I want you to be informed before you engage in anything. I had to first get the picture out of my mind, because I was like, my grandmother? But it was, you know, it was pretty good, and she asked me several questions, and I answered every one, because I wanted my grandmother to be armed with the information she needed to be safe, and to be loved, and to be happy. She deserved that, because she gave so much to others. So I had to talk to her about HIV. What is that? Human immunodeficiency virus. Everybody in here, I'm sure, has heard about HIV. And, let's see, this particular virus can only affect human beings. It's immunodeficiency means that it weakens your immune system. and it destroys some important cells that fight disease and infection. And it really needs another cell in the body to be able to replicate and produce. What is HIV? Again, it can lead to acquired immune deficiency syndrome or AIDS if it's not treated. Only if it's not treated. Only if it's not treated. And I remember being a practicing pharmacist at the time that the first cases were identified and people died. We didn't know what it was, first of all, but they died within months or so. That is not the case now. That should not be the case because we have effective treatments. And so now, here's what normally happens. That little test tube way to the end on my right is, let's say those are cells that fight off disease. Within weeks to months, let's say an infection occurs, the virus starts to replicate, and it starts to affect those cells. And you notice that the number of what we call CD4 cells that help you to fight infections start to dwindle. And before you know it, you have none. And then at the end is when we see the progression to AIDS. But you see, that takes years now. Okay, so how do you get it? It amazes me that more than 34 years, 5 years after we discovered the virus, people still don't understand how you get it. There's still a great deal of stigma out there around transmission. You get it from sexual contact, right? Anal, vaginal sex with a partner who has HIV. You can get it from sharing needles because it is present in blood. And it can be passed from the mother to the child during pregnancy, birth, or breastfeeding. We have significantly reduced that. As long as the mother is aware, and there are laws around testing pregnant women, you are aware and you are on medication, the chances of transmitting the virus to an infant are very low. We've reduced that significantly, but it's still a problem. You don't get it from air or water. You don't get it from saliva, sweat, tears, or closed mouth kissing, pets, insects, sharing toilets, foods, or drinks. You do not get it in that manner. So when I see the stigma that people with HIV have to face, because individuals don't want to be around them, they think, well, we can't drink behind them in a cup, we can't sit with them in a table. Totally not true at all. Totally not true. So this is how it can be transmitted. Now, there are some age-related factors that put older adults at risk. You've already heard all of this about the thinning and dryness of the vagina, which can cause an increase in transmission. Also because people don't want to use condoms because they figured, well, we don't have to worry about getting pregnant, so why should I use a condom? You should definitely do that. And that was one of the conversations I had to have with my grandmother, in terms of you need to sit down and you need to talk to your partner about what types of behavior they've been engaging in. So the first question is, well, what has Mr. Jackson been doing? What has his sexual life looked like? Because, when you sleep with him, you're sleeping with everybody he slept with in the last 7 years. So, oh, I can't ask him that. Oh, yes, you can. Do you go to a doctor and not ask the right questions? When you go into a store to buy something, are you concerned about that? So you can have that conversation. You must have that conversation because it's about your health. And if you don't feel empowered to do that, why would you want to engage in an intimate act with an individual when you can't have a conversation about what you're doing? Touching, speaking, that is intimacy. That's where it starts. And you need to have that conversation about sex before you engage in sex so you can keep yourself safe. Okay, how do you know you have it? I have heard so many conversations about, oh, the person doesn't look like it. There is no look. There is no face. The only way you're going to know is if you get a test. Very easy to do now. Very easy to do. And we recommend that providers in all healthcare settings make HIV testing a routine part of your medical care for persons aged 13 to 64 years. Get a test. Why not? And I hear people saying, well, I don't have any risk factor. Have you ever had sex of any kind? What is the answer to that question? If you have, you get your blood pressure checked, you get your cholesterol checked. Why not get a test? Just to be sure. Just to be sure. Okay, so why do some older adults don't get tested? Well, we find that a lot of healthcare providers don't talk to older adults about it. Why? They may be a little uncomfortable themselves. They may think you're uncomfortable. They may think you're not engaging in any activity that would put you at risk. Some people are still embarrassed or they're scared. They don't want to know. Of course you want to know. The sooner you know, the sooner we can link you to effective treatment, the sooner you can get the virus under control, you can live a healthy life, and you can prevent transmission to others. So of course you want to know. And there's no need to be embarrassed or fearful about it. And sometimes the signs of an HIV infection, when there are signs, may be mistaken for just symptoms of getting older. So you do need to talk to your partner. Is there a cure? No. Let me say that again. Is there an effective cure? No. You have been reading the news about the one patient who had the bone marrow transplant. And he is living, has not taken any HIV meds for quite some time. We can say that we cannot find the virus there, that one person. There is another person who just recently had a bone marrow transplant, but he has not been living long enough without meds to say he is cured. And those are rare cases, rare. There is no effective cure, but we have effective medicine. Yes, yes, it can be. So people with HIV should take medicine to treat it as soon as possible. Because, and this is the good news, if the virus is under control, less than 200 copies per ml of blood, we cannot find it on our lab tests, you have effectively no risk of transmitting the virus sexually to your partner if it's undetectable. We still recommend, using condoms and that kind of thing in our literature, but if the virus is under control, effectively no risk of an HIV positive person transmitting it to an HIV negative partner through sex. That's good news. We've come a long way. Now, is HIV treatment the same for older adults? Well, it really depends on your own individual needs. So there are some age-related complications that are problems in older adults, and you see those. I'm not going to read those. And then, sometimes HIV can increase the risk of other age-related diseases, dementia, bone loss, cancer. Sometimes you can get more risk of drug interactions and side effects, taking the HIV medicine with the other medicines you may be taking. And we do know the immune system in older adults may not recover as well as in younger people. So those are some issues that we see in terms of aging. Here's how you reduce your risk. Not having sex. For most people, that's not an option. It isn't. But if you don't, you're definitely not going to get it. Using condoms, yes. Not sharing needles, taking medicine to prevent or treat HIV. And has anyone heard of pre-exposure prophylaxis? Not very many people. Okay, so pre-exposure prophylaxis, that is giving medicine used to treat HIV to a person who is HIV negative in order to reduce their risk. So the literature tells us that it is an effective way to prevent HIV. High-risk persons, persons at highest risk for HIV. Not for everyone, persons at highest risk. And that's pre-exposure prophylaxis. And we know that it has been shown to reduce the risk of infection by up to 92%. Post-exposure prophylaxis is something different. That's when you've been exposed to it, you think, and if you begin to take the medicine within 72 hours, then we also know that that is also preventive as well. Okay, now let's look a little bit about HIV in older adults. There were 38,739 new HIV diagnoses in 2017. That's why I tell you it is still a problem in the United States. And 1 in 5 of those were women. But the population that's most disproportionately affected are gay and bisexual men. 67% of the new diagnoses were from male-to-male sexual contact. In terms of older adults, though, 3,836 in people 55 and older, mostly were male, 2,662 males, 1,174 females. And take a look at this. Persons 55 and older accounted for about 10% of the new HIV diagnoses in 2017. That's why I'm here talking to you today. It is a problem. And who is most affected? males. Still again, by transmission risk category, gay and bisexual men, and by race ethnicity, African Americans and Hispanics, Latinos. There are significant disparities in HIV infection in the United States. Although African Americans make up about 12, 13% of the population, we were 44% of new HIV infections in 2017. And it has nothing to do necessarily with risk behaviors, it's some of the social determinants. All right, so I want you to see that. And the number of older adults living with HIV is going up. Why? Effective treatment. So people are living longer. You're less likely to die from HIV complications. You're more likely to die from something else. But you got to know your status and get on those meds, okay? Now, here are some of the prevention challenges we see with older adults. Lack of knowledge about HIV prevention. And that goes back to the conversation I said when I had with my grandmother. And I sat down and I asked her, okay, Grandma, what's the riskiest kind of sex you can have? And she just kind of looked at me. What do you mean? And what are the types that you can have? And it baffled me. She didn't know what I taught when she asked me a question, very softly, what is oral sex? And I was like, excuse me? And, she came out with that, and I tried to explain to her what that was, and that was the look I got. People, and I say, yes, people do that. Let me talk to you about that, But you have to know. Knowledge is power. And multiple sex partners, is that a problem in people, older adults? Can be. It can be. Why is that a problem? The more partners you have, the more likely you are to encounter someone who's at risk for either HIV, some other sexually transmitted infection. You want to know, right? You want to know. Low condom use, no discussion with providers about sexual or drug use behavior. We do see older adults are using drugs as well. And that is something to speak about. And stigma and fear. And what I found is, right away when people hear that someone may be living with HIV, the first thing they think is, oh, this gives me an opportunity to make a moral judgment about that person. They must have engaged in some type of behavior that caused them to have it. Untrue. Untrue. What happened? They had sex with someone, or they engaged in some behavior with someone who had HIV and they became infected. No need to make a moral judgment about that. They need to understand why and understand how to prevent it or treat it. And that's what we do. No need to be fearful about it at all. Talk about it. So what can you do? The first thing is know your status. I say that all the time. Get tested. Why not? I sat through that as a healthcare professional because I wanted to know what the patients I was encountering had to deal with. And I must say it was a little trying, but that was decades ago. Things have changed so much now. It's so simple to do, very easy to do. Get the facts, start talking. My husband and I are blessed with 2 sons. They are 33 and the baby's almost 28. I started talking to them as soon as they asked the first question of me. Mom, somebody said on the bus that you can't get a sexually transmitted disease from oral sex. I said, okay, sit down. And we started the conversation. And once they got over the fact that, oh my God, this is my mother talking to me about it, it became very easy, very easy. And by the time both of them were in the 5th grade, I was getting calls from the school saying, please tell your children not to talk to the other, or tell us, that we are wrong, because they would raise their hand. That is not true. This is how you get such and such. But that's good, because throughout the course of their lives, we were able to talk about things. When they were in college, I would go down and talk to their friends. I would have my neighbors coming over saying, can you talk to my kids? To which point I could say, no, I can talk to you, and you can talk to your kids, so that you can have a relationship with them. And now that our kids are adults, I have to say to them, ooh, that was TMI. I probably didn't need to hear that. But it's still a good relationship. You got to be able to talk about it. You talk about your blood pressure, you talk about your diabetes, you talk about why don't you talk about this? It's important. It's important to your health. And be safe out there. That's what I say to everyone. Live safe, love safe, however you're going to do it. And Of course, and these are the conversations I had with my grandmother. Talk to your partner, ask him if what's his status on everything. If you don't know, well, why don't we go get a test together? What's wrong with that? If you can't go with me to get a test, but you want to have sex with me, ooh, that's a little odd. So we need to get together. If you're sexually active, practice mutual monogamy, use a condom every time. If you're positive, treatment early, stay in care. Treatment early, stay in care. And ask your provider about other prevention methods like PrEP. It depends. Most of the research has been done in younger folks, I'll just tell you that. But ask about it. And what can we do as communities? Because, you know, we can prevent HIV. I want to be worked out of a job by the time I retire, which is looking really, really good real soon. And I want to be worked out of a job. I want to be able to say that it would be nice to have a cure, but at least we know how to prevent it and treat it. But we got to keep the conversation going. Got to use platforms like these to talk about it. And wherever we are, we have to create safe spaces to talk about it. Wherever we are, that's the only way we're all going to make a difference and make a change, is to be able to talk about it. And these are my last two slides. In January, a national HIV elimination plan for America was announced. And so the goal is to have a 75% reduction in new HIV infections in 5 years and 90% in 10 years. So the goal is to eliminate new HIV infections in the United States. And we are aggressively working towards that through diagnosing people with HIV, treating those who are found to be infected, protecting people that are at risk, responding when we see outbreaks, and then working on the workforce that will help us to get this work done. That's all of our time and energy now. And I want to end with these bullets, and these are some great talking points for you. HIV is still a public health issue in the United States. Still a public health issue. You don't have to go very far to find it. Georgia, problem. The southern United States, still a problem. And we have more tools than ever to fight it. We do. It's completely preventable. You don't have to have it. You don't. And all of us have a role to play. The most important thing is for you to know your status. That's the power to improve your life. Thank you.
We'll let Dr. Burgess and Dr. Donna, I know, answer your questions. One question I have to start off. You did answer some of it. 10% rate of infection in older adults, and you said that mostly homosexual men are affected. But can you talk about places to get it? I mean, like sex workers, things like that.
You mean why people are at risk for it?
Heterosexuals.
Oh, well, in terms of, the large men are more affected than women, gay and bisexual men more than other risk categories, and that's because the risk of transmission is greater with anal sex than it is with vaginal sex. But, I mean, in terms of being at risk, unless you know who your partner is and their status, it's always a possibility. There are issues around engaging in with sex workers, those who exchange sex for other commodities, et cetera. But it's really about knowing your partner's status, and you don't know that unless that person has been tested. What are the transmissions of HIV for lesbians? Very, very low. Did you hear that? What are the transmission risks of HIV for lesbians? The issue, though, is whether or not lesbian is a term of identity. It doesn't talk about who the person necessarily has sex with. So if you do have sex with men, though, then it's certainly the risk increases. But the transmission risk, very, very low, very low.
So I've gotten several questions about individual issues, particularly with a loved one who has a memory impairment or who has a dementia diagnosis and is acting in ways that make you uncomfortable or make other people uncomfortable, and that you're concerned about their risky behavior. One case of someone's loved one being found in bed in an assisted living facility with somebody else, another case of somebody making inappropriate or flirting with someone other than their wives, and a variety of other circumstances. I think the first thing that any of us will say is we don't have enough information to give you a diagnosis or a treatment plan up here based on one question. What I would say is don't panic. I think when you go into a situation that makes you uncomfortable, sometimes the first thing you want to do is shut it down, hide it, not talk about it, not think about it. What I would say is look at the situation, have the conversation, both with your loved one if they're able to have conversations with you, depending on where they are in their memory loss and dementia, with the other parties involved, with your healthcare provider, to see is the person able to make decisions for themselves or not, allowing them to be part of the discussion and the planning, and making sure that they're safe in the situation. Is the most important thing to do, that they're safe and the other person's safe. That comes, I have to tell you, first before your own feelings, and then the second is having that conversation to figure out if it's your loved one acting in ways that are appropriate, where do you want to go from here? There's a famous case with Sandra Day O'Connor, whose husband who had dementia and was living in a memory care unit, who fell in love with someone else. And she decided she'd rather have him happy than unhappy with her. And so while she stayed married to him, he had a relationship with another consenting, and it was more of a friendship, but with another consenting partner.
Okay, and I'm going to answer these four because there seems to be a common theme here. Can AIDS be reversed to HIV? Yes, with treatment. It depends on the stage, but yes, that's possible. I did not mention getting HIV from blood transfusions. Is that still a danger? Actually, our blood supply is fairly safe in terms of we are able to test it, and so less likely to get HIV from a blood transfusion in the United States. Why is HIV more prevalent in African Americans? And that is a very good question. It's not about risk behavior, so let me disabuse any thought about that. African Americans don't engage in any more risky behavior than persons of other race ethnicities. As a matter of fact, it tends to be the opposite. It tends to be a little bit more conservative. It's more about there are more African Americans living with HIV than there are of other races, ethnicities, so your chances of encountering a partner who's HIV infected is higher, even with less risky behavior. And we know some of the same social determinants that put African Americans at risk for other chronic infections also and put them at risk for HIV. Things like poverty, things like lack of access to quality health care, discrimination in all of its form. And then in terms of mistrust in medical communities, some African Americans still have the notions of the Tuskegee syphilis studies and other instances in terms of engaging with medical providers and will not do so. Also things like in terms of education and prevention in some of our communities, incarceration rates when we talk about fewer partners. So it's really those social determinants. And we're also, in terms of African Americans, less likely to be offered PrEP, less likely to be on PrEP in terms of prevention. Less likely to be virally suppressed, so all of those issues place our communities at higher risk. But I would say it's definitely around social determinants. And then, let's see, why are people encouraged to test for HIV only up to age 64? Looking at the populations that are at risk, I think that was the recommendation around some of the testing guidelines. That doesn't mean that you can't get an HIV test once you're past 64. It's certainly possible, and you can certainly talk to your physician about it.
So another question we got was, what if I am not diagnosed with dementia, but my partner is? Can we still engage in intimate behavior? Can we still engage in sexuality? Yeah, absolutely. If your partner's had a heart attack and you have not, you can still engage in sexuality. If you have not have a dementia diagnosis doesn't mean you have to stop. It means you need to think about and have a conversation about it. Like we've talked about all day, dementia is a continuum, and there may be a time when your partner is no longer comfortable, where you may be concerned about issues of consent because their memory is not what it used to be, because their health is not allowing them to engage in the same behaviors that they used to. And with some kinds of dementia, there's sexual acting out. And you need to talk to your healthcare provider or your clinician about those issues. But continue, this is still your partner, so you should continue. Another thing a couple of people asked is if they could reach out to me with questions about either gerontology education or about my research. I do have business cards. When I leave, I'll leave them at the front desk if anybody needs to contact me.
Thank you.
And this is about testing. Yes, you can get free HIV testing. Health departments offer it. We also have on our website, on the CDC website, a 1-800 kind of HIV test locator where you can locate where you can get tested and done. There are community-based organizations in the area who also offer testing. Yes, you can. You can get free testing. And this, I think, is just, this isn't a question. It just says, donate blood, you get a free HIV test, and contribute to the health of others who need blood transfusions. So thank you, whoever said that. And ask about the slides being available. I will make those available.
I had two other questions, lots of questions. I'm sorry we won't get to all of them. One is, do older folks get more emotional during sexual encounters? My answer to that is it depends. Some people do and some people don't. We've got emotional people and we've got people who aren't emotional. I think that as we get older, sometimes the emotions come to the surface a little bit more for some people. For other people, they don't. So it just depends. We're certainly bringing a whole lot more into the situation. We're not only bringing more partners and the potential for more risk, but also more heartbreak, more experiences with bad encounters in the past, or with loving encounters that can be emotionally triggering. Thinking about your grandmother who is with your grandfather for 68 years. I'm sure it was emotional to begin thinking about starting up with a new partner. Someone asked about opportunity for one-night stands for older adults. I think that you need to think about that in terms of risky behavior, in terms of what your choices are. But finding those kinds of one-time encounters are harder because you're less likely to go to bars and engage in behavior like that. I would also warn, be careful of online dating and online hookup sites. Sometimes seniors go to those sites thinking that there's a great place to meet people, but also there's people who are on there fraudulently looking to take advantage of older adults and vulnerable older adults. So be careful of putting yourself in those behaviors, in those situations.
Okay. That concludes this portion of the program, but before I let you have your stretch break, I know you've been sitting. Dr. Hepburn, can you come up here? We have a component for caregivers. I'm going to let you have your 10-minute stretch break, but Dr. Kenneth Hepburn is Director of the Outreach, Recruitment, and Education Corps at the Emory Goizueta Alzheimer's Disease Research Center. And through the School of Nursing and our ADRC, we do a lot of caregiving research. Dr. Hepburn.
Thanks. So I saw a show of hands of people who are providing care for people living with dementia, and I think there's a lot of you in the room, and there's a lot of people who know people who are providing care. When you think about a disease like Alzheimer's, any of the dementing conditions, we start from the premise that the person who's living with that disease remains a person throughout her entire life, throughout the entire course of that disease. But what the disease is doing is it's making it increasingly difficult for that person to be in touch with and to extend out from that personhood. And what the disease is doing to the caregiver is making it increasingly difficult to reach to and to touch the person who's living with the disease. we offer a program, it's a research program called Telesavvy, the Telesavvy study, and it's up on the screen. This is a fully online, both in-person group video conferencing and daily video lesson course in caregiving. It's Caregiving 101. So one of the basic things we talk about, and that relates to this theme of intimacy, is a caregiver has to learn what is the illness doing, not in general terms, not on a slide, but doing to my person. And how do I reach across that growing gap and provide guidance for days that are as safe and calm and pleasant as possible? And within the context of this conversation, how do I negotiate intimacy with the person? How do I accept it? How do I initiate it? How does it happen? The same question is, how do I help the person get dressed? How do I help the person help me with meals? To know how to do that, to attain mastery in that, you have to learn. You have to acquire knowledge, you have to develop skills, you have to practice skills, and you have to talk with experts and with others about how to do that. And that's what this program offers. Anyone who signs up for it, it's a randomized trial, but anyone who signs up for the program will either get immediately enrolled in the Telesavvy course or will do so after 6 months. So everybody's guaranteed access to the course. There's a research associate sitting out in the hall with flyers, and you have there's something in your brochure. So I do hope that you'll be interested, will sign up, and that if you do, this will be beneficial for you. So thanks for the chance for a plug. Now you can stretch.
Thank you. Stretch break. We got 5